Okay. So sorry, we just want to look at another lecture, which is more of like we're trying to focus on an aspect of congenital heart diseases. So this one, we're trying to look at the causes of congenital heart diseases. If we're saying congenital heart diseases are more of like heart issues that a baby is born with. Now we have a whole lot of heart issues here, but just focus on congenital, right? Congenital, a baby is born with it. Okay, so if we're saying the baby is just born and the baby has a lot of issues in their heart, what could have happened when this baby was inside the mother's womb that has led to these complications? So as an overview, we said that congenital heart disease, they usually arise when the heart or blood vessels near the heart, they don't develop normally during birth. Okay, so the issues was, coming before birth. Sorry, I said during birth, is before birth, right? So the causes are often complex and multifactorial, involving both issues from the environment of the person, genetic composition of the person. Do you understand? So either one of these can predispose you to having a congenital heart disease, or sometimes one of it is what is now bringing the issue. So for genetic issues, it could be that it's a family history. It's just something that actually runs in the family. Chromosomal abnormalities could be related to other issues that has affected your DNA, like Down syndrome, Turner syndrome, Noonan syndrome, all of that. Then single gene mutations. Okay, sometimes it's just a gene that has a problem, but that one is much more rare. Okay, much more rare. So maternal and health lifestyle, that's like sometimes you are having these issues because of your mother, some things that your mother did while she was still pregnant with you. So sometimes it could be that the mother had diabetes. So if you have diabetes, a whole lot of complications from diabetes can also affect the baby. You understand? One of it, I know that the baby is too large. That's fetal microsomia. So fetal microsomia can also, affect the baby. So sometimes it's infections. So those rubella, could be alcohol and drugs. Like she was taking some alcohol when she was still pregnant with you. Sometimes it could be drugs. She abused them, or it was normal drugs that they gave her for one disease condition, but the side effect. Do you understand? The medications. Okay, so some medications taken during pregnancy can actually, affect the baby. Then smoking, if you're smoking or smoking directly or secondhand smoking, though, okay, during pregnancy, is also a risk factor of the baby developing issues with the heart. So for the environmental factors that could actually lead to a baby developing issues with the heart, we have things like environmental toxins. So maybe the mother was exposed to some chemicals, to all those toxins from industries, all of that could actually contribute to a baby having heart defect. Then lastly, sometimes a baby will have congenital heart defect, but the cause is not known. All right, you check, and you can't actually pinpoint a particular thing that actually caused this issue to the baby. Okay. So that's it for the possible causes of congenital heart diseases.